Tondo. Once the cradle of Filipino heroes during the Philippine Revolution against Spain more than a century ago, is now a district name commonly identified as one of the depressed urban areas in the city of Manila. A large number of Tondo's population, of about 600,000, are migrants from the countrysides and nearby islands, nearly half of them belonging to the urban poor. In detail, almost 50,000 families are the poorest of the poor, almost 6,000 of whom are living in shanties built by the riverbanks, under the bridges, and on public lands where basic health needs have become a luxury. More than half of the families have no access to garbage and sewage disposal system. They have no toilet facilities to speak of. They live their below poverty line lives in one-room dwellings with a water faucet they share with countless others. The vacant lots and available spaces on which the homeless build their makeshift homes have become seedbeds of occupational and contagious diseases. Amidst these stark realities in a depressed urban area such as Tondo, stands the Mary Johnston Hospital, a hospital that for many decades has served as a symbol of hope for the underprivileged sector of the community. It was on December 10, 1906, when the hospital began its healing ministry in a room of the Bible Training School for Women, located along Rizal Avenue in Santa Cruz, Manila, next to the present site of the Knox United Methodist Church. It was then known as the Dispensarium Italia. Dr. Rebecca Parrish, a missionary doctor from Indiana, USA, who was sent here in the Philippines by the Women's Foreign Missionary Society of the Methodist Episcopal Church, laid the foundation of the healing ministry with the assistance of 3 young students of the Bible Training School, who later became the first student nurses. Early in January of 1907, a regular nurse from the United States arrived to assist Dr. Parrish. 2 rooms with 10 bamboo cots were added to the small clinic to accommodate the growing number of patients coming for treatment. Thus, the School of Nursing began. In 1908, Mr. Daniel Johnston, a Methodist layman from St. Paul, Minnesota, donated $12,500 to the mission as a memorial to his late missionary wife, Mrs. Mary Johnston. The money was used to purchase a piece of land where the first 3-story Mary Johnston Hospital building was erected with a 55-bed capacity. At the outbreak of the Second World War, casualties from the Japanese bombings of Manila were taken to the Mary Johnston Hospital for treatment, including those from the Cavite Navy Yard. Medicine and food were scarce, and the hospital staff seldom received their pay, yet no one ever complained nor ceased to serve. On February 5, 1945, during the liberation of Manila by the American forces, the hospital was razed to the ground, and almost everything in it was reduced to ashes, save for the skeleton of a concrete porch where the signboard of its name, Mary Johnston Hospital, still hung. To the staff, this became a symbol of things to come.
that out of the ruins of what was once the old and smaller hospital would rise a bigger and better hospital. And after 5 long years of waiting, the United States of America once again came to its rescue and helped the hospital rise from the ashes. They donated 1,200,000 pesos for the construction of a bigger and more efficient hospital. On August 26, 1950, the new hospital building was inaugurated by no less than the late Philippine President Elpidio Quirino. As part of his speech, he said, "I wish there were more hospitals in the country that can render as much service as this hospital has rendered." The newly built Mary Johnston Hospital became a general hospital, ministering to men, women, and children. A modern hospital fully equipped with an X-ray department, a laboratory, a complete medical, surgical, obstetrical, and pediatrics departments, and an OPD and public health unit.
In 1999, the Board of Trustees, together with the management officials and supervisors, sat down and formulated the vision, mission statements of the hospital. This was the first time that the vision mission was crafted, and this represented the dream of the staff of what they would want the hospital to be in the new millennium. The vision, as crafted, is sharing God's love by being the center of wellness and excellence in the health and education ministries in the new millennium. The mission statement, Mary Johnston Hospital shall provide the highest standards of medical care, community service, quality education and training to fulfill the Great Commission which the United Methodist Church is committed to. Today, Mary Johnston Hospital is accredited by the Department of Health, the Philippine Health Insurance Corporation, the Philippine Hospital Association, and the different specialty societies as a tertiary and training institution. We have a recognized residency training program in the 4 clinical departments: in internal medicine, surgery, OBGYN, and pediatrics. Presently, we have 34 resident physicians, 117 active consultants, 63 visiting consultants, and 16 associate physicians. The present 234 salaried staff includes 86 graduate nurses. Not many institutions reach their centennial year, but through God's grace, Mary Johnston Hospital did it. As it was in Dr. Rebecca Parrish's time, we at the Mary Johnston Hospital today admit all patients who come to us, regardless of color, creed, religion, or political persuasion. Even with our limited resources, we strive to provide them with the best medical services available. Our medical staff, the nurses, and paramedical staff are a dedicated lot who are all committed to the cause of sharing in God's healing love for a healthy and renewed community. We could have opted to transfer to a more affluent site where there will be rich and paying patients, as other hospitals did. But Mary Johnston Hospital chose to remain right here in Tondo, Manila, because this is where the mission work is.